Just a quick note before we get started. This is a very complex and sensitive issue, touching on all sorts of things: sex, religion, culture, bodily autonomy, parenting, etc., etc. We unfortunately can't include everything in this episode, so if you want to read more, check out our newsletter to continue the conversation.
I'm Manny.
I'm Noah.
This is Devin.
And this is No Such Thing, the show where we settle our dumb arguments and yours by actually doing the research. This week, to cut or not to cut? That's the question.
There's no such thing. No such thing. No such thing. No such thing. No such thing.
All right, we're talking about circumcision. I actually remember a while ago talking to my then girlfriend, now wife. I don't know why I brought this up. There was no reason for me to bring this up, but I was like, I think, within the next 50 years, circumcision is going to be much less common in the United States. I was just like...
You just had a hunch?
Yeah. I don't know why I brought this up over dinner, but I was like, I just think that's the way things are going to go. Since then, it'll come up once in a while, and I'll hear from people who say, oh, yeah, I would never let my kid get circumcised.
Mm-hmm.
And most of these people, and I haven't asked or confirmed, but most of them are circumcised.
Yeah.
You haven't checked?
Like I said, I haven't checked.
Assume probably, yeah.
Sometimes it's at least intimated that that's the case.
Yeah. This happened to me, but I wouldn't do it to my child.
Yeah,
sort of energy.
essentially. Yeah. Not even so dramatic, but yeah, basically like
we have to break the cycle.
Yeah. So and then I'm wondering, okay, well, why is it? Obviously, I'm Jewish.
Yeah,
it's common practice to do so.
Yeah.
Most people in the United States are not Jewish.
Yeah.
Based on the numbers.
Yeah, a large amount of them are not. Same with Islam, similar. You know.
Mm-hmm.
And I do know that in Europe, it's much less common for babies, where I think it's a bit more restricted to kind of the cultural, or religious reasons.
Mm-hmm.
I was curious, like, how that even happened. Like, why in America did this take hold so strongly? And then, you've heard ambiently over the years, like, it, reduces HIV and AIDS,
right.
which I've always wondered about, like, how does that work? Like, what about this piece of skin or not would impact that? No idea. And then arguments about how it affects pleasure.
Yeah.
Then you'll see in Union Square here in New York or elsewhere, you'll see people
protest.
Activists, intactivists, talking about.
Intactivists?
Yeah, that's what they call them.
That's incredible.
And saying like we need to end this barbaric practice.
Yeah.
Because it reduces your pleasure. It's really brutal to the babies, and also my sex life is ruined because of this that happened to me.
Circumcised.
Yeah.
And I've always been kind of like,
maybe that's
I think it's like a grass is greener situation where it's like, I don't know, it seems okay. I guess I'll never know. But, So these are things that have been swirling around in my mind. So research from Johns Hopkins says from 2012 to 2022, circumcision rates among newborns have dropped from 54.1% in 2012 to 49.3% in 2022. So about 5% less.
Wow.
And this is in the U.S.?
Yeah, in the U.S.
Okay.
That kind of confirms that we're on, 5% is big but not huge.
Yeah.
But if that continues,
pretty sizable.
Yeah. And I feel like now with maybe the way things are going culturally, I would imagine that rate would increase. And my guess would be once it's less common where it's like, okay, less than half are done. If you're on the fence or you don't really feel strongly and the doctor's not really pushing it on you or whatever, it'd be easy to just be like, yeah, we don't need to do this.
Yeah. No longer will be the norm.
Yeah, so, it's like if I'm having a baby and I have no idea what's going on and they say, well, 80% of babies do this.
Exactly.
I'm just going to be like, it's the path of least resistance. It's like, just do it. Less to deal with.
Yeah, that's why I'm circumcised. I actually asked my parents why.
Yeah.
Because it's not common in East Africa where they come from. So they were just like, well, the doctor told us that's what that's what you're supposed to do.
Yeah.
And that's
what they did.
And now I'm gone.
Sorry to hear that, man.
Yeah, and look at your life. Yeah. Think of what you could
I
have
definitely
been.
remember.
Think about who you could have been.
at Ohio State when I was in college, there were so many activists / protests about this.
Really?
Yeah.
Wow.
They would. Yeah, they would.
But
be
why
all
at
over-
Ohio?
They
At
go-
school?
It's common for like people like the kind of anti-abortion activists too. It's common to go to colleges to like get.
I guess
get
to put it.
impressionable
Oh, I
people.
guess to implant it in. I'm like, because
Yeah.
you think of people at colleges not having children, but
Yeah.
if they
just
say
say-
something at that time, maybe down the line,
But
you'd
then
be
I
like,
remember being like, okay, these guys are crazy because like
Yeah.
of course some of the behaviors in these
Yeah.
protests, I was like,
doing
all
a
right,
bit
Yeah,
much.
it's an
But
eccentric
then-
thing to focus on. I
yeah,
think.
yeah, of course. And then, but then, like, now that I'm older, I'm like, well, yeah, I guess why do we do that?
Yeah, it's a valid question, and yeah, it's like the people that I've spoken with that are of a similar milieu. They aren't like crazy people. They're like
Good word.
normal people working,
Yeah,
have long-term partners. They're not like, wow, I can't find a girlfriend because of what happened to me, or I can't
Yeah.
enjoy sex, or it's like
yes,
it's not like these kind of hang-ups that I imagined had some of the more fringe characters were
exactly.
focused
yeah.
on. It's like more of a normal thing. Like it's just unnecessary.
Yeah,
And yeah, it's painful for the babies.
mm-hmm.
So yeah, I mean, what do you guys think?
And I remember the first phase of even learning that people were upset about this. Me just being like, they're weird because this,
Yeah, everyone does
We all
this.
do this one thing, and they're weird for not
Yeah.
for being upset about it. Now, as an adult, as someone with a more open mind, I'm also like, yeah, I guess. I mean, I don't know. If I had a son, I don't think I would do it at this point. Now, I would say like when he gets old enough or whatever, here's what the doctors used to say if you want to do that.
You would
yourself.
support him in his journey.
Yeah, I wouldn't give a shit.
Sure.
I mean, I'm circumcised. I have a great life. There's no I'm not really upset about
I have a great life.
I love you. I love you, son. No matter what you choose to do.
it hasn't really I can't imagine a scenario where it has affected my life at all.
You can't imagine a life in which your sex life is better.
Yeah.
It's so good.
I guess
Think bigger.
everything can be better.
Yeah.
But
But you
like,
don't feel like you're missing out.
No.
Okay.
No.
It's sensitive enough.
But I don't
Yeah.
know what I
it's like that's what they say. It's like the
what they
sensitivity, the nerves. It's like
You guys
like
don't
the
know.
nerve ending.
You're
it's not.
missing out.
Maybe if I like
It's
walked
crazy.
around naked all the time, so like it's
feel
like,
the breeze.
Yeah, it's like I don't know. Like
It's insane.
feel more
Yeah.
of the breeze.
My non-circumcision
Wow.
journey. I'm outing myself as uncut gem.
crazy. Yeah.
It was a similar thing though. Like you talked about how your parents were like, I don't know, they just told me to do it.
Yeah.
Because it was like there was a few family members around that time where I guess wherever hospital they were going to, they were just sort of like, well, you don't have to do it now. Like you can do it down the line.
Yeah.
So for a while, I thought I was going to do it sometime in like middle school or college. And then I just kept waiting because I was like, well, there's not really a great time to do this.
Yeah.
Like, I was like, am I going to have to miss school? Because my parents were like, the assumption was they were like, we can leave it up to you, but like you would probably get it done, but just when you're older. And it was the sort of thing where, in my mind when I was younger, I was like, okay, I'm definitely going to get this done. It's just a matter of when.
Yeah. Plotting.
Yeah, I was like, all right, it's just, I got to figure out. And then it just like never happened. And it was a thing I would say when I was younger, I was very self-conscious about.
Yeah.
Because, I think the norm, and especially in the U.S. at the time, was like everybody else is circumcised. Like, why aren't you?
Yeah.
Yeah.
And then, like as an adult, like Manny said, it's like has not affected my life in any way.
You would have been a perfect test case if you did go through with it.
I
We
know
could have asked you
for the
before and after.
podcast,
Yeah,
I
exactly.
should get circumcised to see.
Yeah. So after the break,
Come on in, doctor.
Oh man. So when I was younger, my parents like emphasized like because my dad was circumcised, but they emphasized like you have to, pull back your foreskin, whatever, to
Yeah.
clean it. So it just became a part of the process, right?
Yeah,
it wasn't
yeah.
like it's like, we were talking about shower, you wash your legs. It was like, okay, I gotta wash
That's
my
why
dick.
he's in the shower so long.
Yeah,
yeah,
Takes extra
lots,
time.
lots to wash.
a lot more folds to uncover.
Folds. Let's see here.
But so it wasn't, to me, it wasn't like a sanitary thing. Like for me, it was more of a concern. I was like, oh, when I start having sex, is this going to be weird?
Yeah.
Yeah, the social.
Yes.
Yeah. That to
impact.
me seems like the bigger issue.
Yes.
for
Yeah.
lack
So
of a
that
better
was
word.
the thing that was top of mind for me
Yeah.
before I was having sex. keep it PG, but it has not been an issue. No one has ever complained.
What's wrong with it?
Was there ever did anyone ever ask you or seem confused or did it just?
No,
because I would imagine someone, if that was happening, I don't think I would say anything.
If you encountered,
and I was surprised.
What the hell is this?
I'd probably talk to my friend afterwards and be like,
Yeah.
what's up with that?
Just to keep us going, I'm definitely interested in the bigger picture here, the decreasing rates. Is there actually a good reason to be circumcised, or is this more antiquated practices from the past that we don't need to do anymore? Yeah,
because I've read pieces by men who are circumcised who basically echo what we've been talking about. I wouldn't, for my son, I was reading a piece in Esquire, and it was a guy, I think in his 60s, who had his son circumcised. His son's now in his 20s, and he was saying how, and I think he's Jewish, and he just did it because it was what people did. Yeah. And he was I really regret it, and I wish I hadn't done that to my son. It made me just think about it, because I was my default was always
it's true.
Yeah, definitely. Yeah, and I think we'll see how I feel having some research, but right now I think if I had a son, I would do it for all the reasons. Not that I'm so religious, but it's I don't know, there's something to it where it's why change it now if it's not causing harm to me? I mean, so we'll see. Maybe my mind will be swayed.
It's funny. I feel like I don't know that much about it.
I want to do some research on the real historical history of it, especially the American history of it, and then look into the health and sexual pleasure aspects and what's behind the declining rates.
That I am very curious about.
Yeah.
I guess I'd be pretty pissed if I found out that it's
so much better.
3 times better. Or whatever.
Yeah, but then it's you
don't know what you never had.
Yeah, and it's good to cut out some vices, it's
yeah, that's true.
Yeah.
Maybe I'd be addicted.
Sex crazed.
Yeah.
It could be
you won't be able to hold a job.
You don't know what it's like.
Yeah, it'd be crazy. it's better,
It's a sick life to live.
Yeah.
Or maybe having the foreskin means you get a fuller experience that you don't need as often.
No, you'd be begging for a fix.
Maybe we need it more because we feel less.
Yeah.
We don't. Maybe we're not getting the real.
Yeah, exactly. It's it's a tenth of what you could be getting.
Yeah.
So you need to do it 10 times.
Instinctively, our brains are why isn't this?
Why isn't this better?
Let me try this again.
Let me run it back.
So in this episode, we're going to hear from a few different people. 1, an epidemiologist who studied the health impacts of circumcision. 2, a sociology professor who's researched the anti-circumcision movement. And 3, a leading member of the so-called intactivist movement. And just one quick note, this is an issue, as you'll hear, that people are extremely passionate about. In this episode, we're not going to be able to cover all of the complexity of the issues, but we're doing our best to hear everyone out and get their viewpoints across. If you want to look into this more, I'll be linking to research and other analyses in the newsletter to get more insight and decide how you feel about it. We all have our own views here, but we're not trying to force any particular agenda. With that said, we've got a lot to get through, so let's get into it after the break.
All right, fellas, I need you to help me with a problem that I got. Usually we're the ones helping other people with their problems, but I'm about to go abroad and I want to watch Met games. Noah, how can I watch them?
That's a tough one. Maybe get a really large telescope.
I don't think that's the best way to do it. Manny, do you have any solutions on how I can watch Mets games abroad?
I think I've got a slightly more practical solution for you, Devin. If you use NordVPN, you'll be able to change the location of your laptop's IP address and watch the content with no problem.
What about my privacy online? I'm worried someone's watching me.
First of all, no one is watching you, Noah. But in case someone was watching you, NordVPN provides you with privacy online, leaving no digital footprint by hiding your IP address. It's like wearing an invisibility cloak while you're surfing the web.
Sounds comfy.
So, Manny, I've heard about these VPNs and how they're super slow. How do I make sure my internet is not throttling?
If you want to use a VPN without slowing down your internet, Devin, you're going to want to use NordVPN, because whenever I use it, I don't see any buffering or lagging while I'm streaming my favorite content.
How do I get NordVPN?
Devin, if you or our listeners want to get the best discount off of your NordVPN plan, go to nordvpn.com/NST. Our link will also give you 4 extra months on the 2-year plan, and there's no risk because Nord has a 30-day money-back guarantee. The link is in the show notes. That's nordvpn.com/NST.
Before we get further ahead, I want to talk through the history of circumcision as a religious practice and a medical one, how it became so common here in the U.S., where it being so common makes the U.S. an outlier compared to other nations.
Gotcha.
And then we'll talk through kind of the perceived risks involved, the potential benefits and impacts on sexual pleasure, and, all the other concerns people have. So we've got a lot to get through, so let's jump into it.
Dive right in.
All right, so I'm going to run through really quickly kind of the ancient history to get us up to speed. Circumcision dates back thousands of years. I read a book called Circumcision, A History of the World's Most Controversial Surgery by David Gahler. Sorry if I'm pronouncing that wrong, sir. And it points to evidence that Egyptians may have been performing them as early as 4000 BC.
Wow.
No one's really sure why, but some idea of a transition into manhood, a mark of elite status, and or just hygiene and cleanliness.
So this was later in life, though.
Yeah, so it would be
saying.
like, there's like great in carvings, and it's like, it looks like probably 13-year-old boys out there.
And this is, maybe my timelines are wrong, but 4000 BC would have been before like a Judeo-Christian
Exactly, yeah, so
ritual.
So that, basically, it's thought that Jews adopted it from the Egyptians.
I see.
A bit later. And their use was mainly as a covenant with God, so it's basically like, you do this for me, like to prove you're really about this,
Allegiance.
and you're one of us,
You're about that life.
yeah, so it's like literally a mark. And then there's also theories that it's kind of about either like fertility or just like sexual power. Yeah. Originally they were doing it a little bit older, but then they chose to do it on newborns because it was like easier to do. Because if you're like, well, you got to do this when you become a man, it's tougher sell naturally. You still hear about that today. So Moses, who gave this decree, he was not circumcised himself. And there's interesting stuff where people used uncircumcised as an insult. So like people think he had a speech impediment, and they said like he's speaking with uncircumcised lips. Or then like if someone's being ignorant, they'd be like, oh, like you're using your uncircumcised ears right now. So I'm gonna start using that.
That's incredible.
I think that's good stuff.
Acting real uncircumcised.
Like if they're not paying attention to something, it's like, oh, you're
Man,
uncircumcised
y'all
right
just
now.
unlocked a new
new
insult for the pod.
Yeah, stay
I
tuned
better
for
act
that.
right.
Or like,
going on.
you got a filthy mind or something
Yeah.
too. Like any sort of kind of like,
Unclean.
there's obviously always a link between like kind of cleanliness or hygiene and then like dirtiness and all that encapsulates.
I see.
So yeah, links to fertility and also sexual virility. So on the flip side, to discourage sexual pleasure. Later on too, you hear about this as an idea to curb masturbation and kind of impure sexual thoughts.
That didn't pan out.
Yeah, jury's out on that. Yeah.
Shit.
Whoops. So you won't be distracted with that when you should be focused on God and other things.
And the thinking being, it doesn't feel as good, so not as much temptation.
Exactly. Okay. So yeah, you won't be so worried about it. So fast forwarding, of course, Muslims also adopted it. Some scholars there saying the foreskin trapped impurities in the body. And many Aboriginal tribes in Australia and across Africa also practice it. Reasons and specifics and customs vary, of course, but a lot of times it's like a manhood ceremony as a test of bravery. So that's like, we're waiting for you to become a man, and then it's like, to prove it, you're gonna have to do this, and it's gonna be painful and hard and scary.
It's so fascinating that different parts of the world were
yeah,
doing
like
this at the same
I
time.
originally assumed it kind of all stemmed from like the Judeo
and then spread
thing,
from
and
there.
then just spread. But yeah, it's like kind of this thing where lots of people had this idea for whatever reason. But
that is so weird.
Yeah. So then moving along to our boy JC. Christianity dropped circumcision, even though we know our boy was a cut king,
Yes.
a cut king of kings. There's lots of paintings of this.
Paintings of the depiction
Of him getting circumcised,
okay.
yeah. So some people think that they've replaced circumcision with baptism as a way, one, to include the ladies, because you could do that. And then also it's because Christianity is more outgoing and mission-based, where you're trying to spread the word and get people involved, which you don't really have as much of in Judaism. But it kind of follows that they wouldn't want anything that's restricting and kind of daunting, like circumcision, to be in the way as a barrier.
45-year-old man.
Yeah. So it's like,
you're saying you got to get circumcised to be
versus just
part
be
of the
like,
religion.
dip your head in some water.
much nicer
Boom.
experience.
You're good. So now we're fast forwarding hundreds and hundreds of years to why America,
Okay.
which is not famously a majority Jewish or Muslim country, as
Yeah.
you guys are probably aware. So why and how did it become so popular here
This
in
is
America?
what I'm interested in hearing.
Yeah. So to learn about this, I talked to our first guest, Dr. Kate Grabowski. She's an associate professor at Johns Hopkins University and an epidemiologist. She studied impacts of interventions on HIV and sexually transmitted infections, including male circumcision. So here's how circumcision took over the U.S.
Prior to the 1870s, it was really uncommon. So it was mostly practiced for religious reasons among people who were Jewish or people practicing Islam, which is where it's still very common today. And then in the 1870s, there was this orthopedic surgeon, Louis Sayre, and he was treating boys who had problems walking. And he had this one boy who had a lot of trouble and was experiencing paralysis. And he had this idea to circumcise him for whatever reason, and he did, and for some unknown reason the boy was able to walk afterwards. There's no reason to believe circumcision cures paralysis, so I don't know what happened here, but anyway, he thought it was this like amazing cure, and he apparently did this several other times and noticed benefits, and then he started going on the conference circuit and really getting circumcision into the forefront of the medical community's mind in the U.S.
So the practice started to gain some traction, and then around the turn of the century, germ theory started to take hold in the U.S. Lots of concern about cleanliness and hygiene, and people viewed circumcision as one way to improve it. Next, births moved from the home to the hospital, and circumcision became a bit more routine in those settings.
So that sort of reinforced what was happening. And so it was this whole sort of spiraling of things happening all at the same time that sort of led to these really high levels of circumcision. And by the 1950s and 1960s in the US, you had like 80 to 90% of boys in the US being circumcised.
No one's really sure why it seemed to
off,
cure
like,
that
got the
paralysis
kid's
back in the
legs.
1870s. There's theories that it was like there was some inflammation, and then once that cleared up, it, freed up the rest of his body. I don't know, but no one's really sure. It is kind of just a strange thing. But that's kind of where it first took hold and then spread from there.
So if it didn't help that kid randomly in the 1870s, there's a world where, there's no domino effect.
Yeah, it would have
and
never
then
caught on necessarily to that degree.
So that is fascinating that the doctor was like, you know what I think's going to help?
Yeah, they were just trying anything. But yeah. But then it makes sense once we're moving from home births to the hospital.
Yeah.
Why then it's like, okay, we know this is pretty good and helps with hygiene or whatever, and germs and all that were known then. So it makes sense that like we'll offer this and kind of just do it, and then it becomes the standard just because then I do think then there's a huge factor of just, well, it's common, everyone else is doing it, and then it spreads that way. So that's how we got this major rise in circumcision rates and how it became standardized here in America. But believe it or not everyone agreed with this. So once the circumcision rate peaked in the 50s and 60s, the decline then began. So to learn about the burgeoning intactivist movement, I spoke to someone who studied this extensively.
I'm Laura Carpenter. I'm an associate professor of sociology at Vanderbilt University, and my research is about gender and sexuality and health over the life course. And one of those health and body issues is circumcision.
First, can you give kind of an overview of the intactivist movement? When did it kind of start rising up, and just how would you describe that?
Okay. Nice pun there, by the way. In the 1960s, there was a big wave of things that we would associate with the 1960s almost, but in medicine, right? You start seeing physicians particularly challenging male circumcision and just saying, why are we doing this? At least if we're going to do it, we need to demonstrate that it works or does what people say it's going to.
Professor Carpenter described this swirling of ideas all contributing to a ripe environment for anti-circumcision activism. Hippies and the idea of going back to nature, and things like the gay rights movement, speaking more openly about men's bodies and sexual pleasure. Then women's health and the book Our Bodies, Ourselves.
And the patients' rights movement is ramping up at this time. So, in the 1960s, it wasn't uncommon to not tell patients who had cancer that they had cancer. Informed consent as we know it didn't exist. Physician beneficence was really the test for whether a medical procedure was appropriate or not. And people started questioning that as well.
So a combination of things leads to a questioning of circumcision within medicine and outside medicine. A grassroots movement around patients' rights doesn't morph exactly into the anti-circumcision movement, but it does feed it.
In organized pediatrics in the 1970s, you get in the Canadian Pediatric Society and the American Academy of Pediatrics, both produce statements that say circumcision isn't really medically necessary. People started talking to each other. Basically, there was a group of nurses in Santa Fe, New Mexico, who became conscientious objectors and refused to assist with circumcision because they didn't think it was useful. In fact, thought it could be damaging. So it's sort of the 70s when this really gets going in the United States. And then Marilyn Milos founded an organization, the abbreviated NOCIRC, National Organization of Circumcision Information Resource Centers. She was a nurse who was pretty appalled the first time she witnessed a circumcision. And the attending physician said, yeah, there's no reason we do this, ha, ha, ha.
The day that I witnessed a circumcision, my life changed. The life that I knew was gone. When I started to cry and the doctor said there's no medical reason for doing this, and I realized my own sons had suffered this. I'm going to start to cry probably, but that my own sons had experienced this and that I hadn't known enough to protect them. I didn't want one more parent or one more baby to feel like that.
Now, there are, of course, people who think that there are still good reasons to perform a routine circumcision. So, the debate about whether or not it's medically useful continues. NOCIRC is founded in 1986, I believe. And then there's sort of like little organizations all kind of popping up.
Circumcision's got to go. Hey, hey. Ho, ho. Shave, shave, shave.
So, the only mammal on the whole of the earth. And are you not suspicious that men, human males, are the only mammal where this is supposedly necessary immediately after they're born?
Some focused on helping men restore their foreskins. Some focused on sort of working with medicine. Some focused on working with legal issues. And so there's this sort of proliferation of groups in the 80s through the 90s.
And I had the chance to speak with the founder of one of these anti-circumcision groups myself.
My name is Georganne Chapin, and I am currently the founding executive director of Intact America, which is a not-for-profit organization that wants to change the way that America and Americans think about circumcision or male genital mutilation.
She told me she's been interested in circumcision from age 10 when she saw her baby brother come home from the hospital, circumcised.
And I just started thinking at that age, why would a newborn baby, why would all boys, essentially, which is how it explained to me, need corrective surgery right after birth? How could all males be born needing surgery? It made no sense to me. And believe me, I knew nothing about evolution. I certainly knew nothing about medicine. I was 10 years old, and it just seemed weird. And then when I was in college, I studied anthropology, and I was always interested in medicine sort of as a social phenomenon. And I was always interested in equity, and I started hearing about female genital mutilation and how horrifying it was. And the same people who talked about how horrifying female genital mutilation was thought that male circumcision, most of them thought male circumcision was different, that it was fine, that it was for the boy's own good, that female genital cutting was discriminatory, but male genital cutting was good. And it just was crazy to me.
Decades later, Georganne went to law school and became involved with the fight against infant circumcision herself, founding Intact America with a few other people in the movement. So I had to ask Georganne, why does she think the medical establishment in the U.S. is so insistent on this procedure? What's the motive?
Around the end of the Second World War, the United States established a profit-driven fee-for-service medical system, whereas most other Western countries have some kind of universal healthcare system with a large public-supported component, whereas the U.S. has a fee-for-service, privately driven medical system. And circumcision is charged for if what we call fee for service, right? The doctor does something for a person and collects a fee. Hospitals collect fees. They collect from insurance companies, they collect from individuals. So circumcision generates money for doctors and hospitals. People will say to me, how much does a circumcision cost? And it's like, depends. That's a lawyer's answer, but it depends. So I've heard of Beverly Hills urologists who will charge $3,500 for a circumcision. And I've heard of obstetricians or pediatricians in a poor southern state who will charge $40 or $75 for circumcision. And insurance sometimes covers it. Some insurance does, some doesn't. Some states' Medicaid systems cover it. Some say they don't cover it, but they subcontract out the healthcare to private insurance companies, which can choose to cover it or not. Those are the complex facts about medical circumcision itself, fees and what's charged.
Georganne says circumcision is pushed heavily on expecting mothers. Part of Intact America's work is conducting a lot of research surveys, and she cited some of their data on this point.
So another study, Intact America, another survey we did, found that mothers are asked 8.4 times on average whether they don't want to circumcise. What, you're going to circumcise your baby, right? Sign here. Of course you're going to circumcise him, right? What do you mean you're not going to circumcise him? An average of 8.4 times during the perinatal period, immediately preceding the birth and immediately after the birth. This is really important. Circumcision is marketed to new moms. It's sold aggressively to women. So when people say to me it's not a women's issue, it's like, it wouldn't be happening if it wasn't for moms, new moms. They are asked to sign off on it. They are told it's important. They are told that it's part of being a good parent. They are told it's good for the baby. The same way diapers, children's clothing are marketed to new moms, toys. We have a bumper sticker that says 10 out of 10 babies say no to circumcision. So the ethics of circumcision, bioethics says that if you're not sick, a doctor shouldn't be performing procedure. If you're not sick and if you can't get consent, and proxy consent, parental consent, is invalid for a procedure that does not save the life or health of a child. And because circumcision is non-therapeutic, parental consent is legally and technically invalid, but we have given the surgery an enormous pass.
I asked Dr. Grabowski, the epidemiologist at Johns Hopkins, about this profit motive idea to hear her view as someone on the medical establishment side of things, and she was doubtful.
Here's the thing, it's like circumcision has all these downstream medical benefits that actually save the healthcare system a lot of money at the end of the day and save future more expensive billable procedures. So I'm very, very skeptical of that claim. Like it's pretty cheap and it takes time. So I think, I don't think Hopkins is banking money off of circumcision.
But now might be a good time to talk about the alleged health impacts of circumcision. So here's what Dr. Grabowski told me the research says.
I think we should step back and talk about what the foreskin is, right? So the foreskin is basically a piece of skin on the tip of the penis, and circumcision removes that. So the foreskin, it's a thinner tissue that's more susceptible to abrasions and tears during sex. It also is very rich in target cells for viral sexually transmitted infections. It also is a really nice environment for anaerobic bacteria that are associated with BV in women. But for men, they can produce inflammatory environments that make it a very nice area for these viral sexually transmitted infections to take hold. So the randomized trials randomized men 1-to-1. These are men who are willing to undergo the circumcision procedure. So I think it's really important that people understand that participation in these studies is voluntary, and what we're measuring is voluntary medical male circumcision. They're choosing to enroll in these studies. And so these randomized trials are like really what we consider the gold standard of evidence, because you are sort of balancing factors across groups that might otherwise obscure whatever findings you're hoping to look at. So we enrolled thousands of men in these trials in Uganda, Kenya, and South Africa. And then they followed the circumcised men and the uncircumcised men. And then they looked to see how many cases of HIV, HSV2, HPV, genital ulcers they observed in these men afterwards. And then they also followed the partners of these men in many cases to look at the secondary impacts of circumcision. The really big finding was that it reduced risk of HIV acquisition by 60%. It's incredible, right? It's a one-time intervention that provides this sort of lifetime risk. We also found a 30% reduced risk of HSV2, 25 to 30% reduced risk of HPV, and that's associated with penile cancer and cervical cancer in women. The other thing, reduced genital ulcers by 50%. Genital ulcer disease is really, really painful for some people, specifically ulcers caused by HSV2. It can be awful and very stigmatizing. So that's another benefit. In women, female partners, we found reduced rates and levels of bacterial vaginosis and trich as well, and also HPV. So there were these downstream benefits to partners, and then there were also these direct benefits to the men themselves.
Those are huge numbers.
Yeah.
If you're wanting to make the decision, you might just be like, well, whatever, I work on them anyways. And
Yeah.
So I'm not.
Yeah, I
doing
mean,
it.
certainly
It's like,
these things are avoidable, of course.
yeah.
With
But-
or without circumcision.
Mhm. But I was surprised that there was such a drastic difference.
Yeah.
But 60% for HIV?
Yeah.
That's pretty high.
Which makes sense.
Yeah.
When she was saying like the extra skin is thinner and more susceptible to like
tears and stuff, and
that's
like
why
you know, in your head you're picturing
specifically.
like these huge tear, but I think it's like more like
Tiny,
tiny abrasions that you
microscopic.
probably wouldn't even notice,
Yeah.
or like see as an issue necessarily. Not that I would know. So I thought that was interesting and helpful, at least in understanding kind of
Yeah.
how this is even, what the actual theory is on how that works. And we wanted to know, what are the impacts on sexual pleasure beyond just health? Here's what Dr. Grabowski's research shows.
We did ask men about sexual pleasure and sexual function before and after the trial, and the majority of men reported no difference at all, and some reported increased sexual pleasure, likely because they weren't dealing with all the STIs that impact sexual pleasure at the end of the day. And women also reported a lot of increased sexual pleasure because they weren't getting these infections either. So the data was shockingly good, and it was very consistent across all of the 3 trials. So there were 3 simultaneously trials going on at the same time: Uganda, Kenya, and South Africa. And yeah, it was, I mean, it's kind of amazing. They all found the exact same effect, and like that never happens for us.
The increased pleasure is because you don't have an
Yeah,
STI,
I don't
so
think
that's
it's
like-
really an argument that it's like
Better.
it's gonna feel better
Yeah,
to do
yeah.
this if all else being equal.
I want to know the difference between like, you know, 2 people, one uncircumcised, one not, that don't have STI.
Yeah.
Like that's what I'm curious
Yeah,
about.
I'll look. I'll
Well, it
dig around to
sounds
see if
like
there's
it
a little
doesn't
more. But yeah,
affect it.
it's
Well, not a noticeable amount.
From a
You know.
medical perspective, it's worth the trade-off.
Yeah, I think that's the main idea there. Now, on the other hand, here's what Georganne from Intact America had to say about these studies.
So those original studies in 3 African countries, those studies have basically gone by the wayside. And there is no association anywhere in the world, including studies done in the American military, major studies done in Canada, the entire European continent, that shows any kind of an association between HIV and circumcision status. So it doesn't show more HIV or less HIV with circumcised men versus non-circumcised men or intact men. So those studies have been ignored and discredited. These are people in sub-Saharan Africa where access to basic medical care is lacking. Children and mothers dying in childbirth, and to take a whole posse of American researchers, all circumcised themselves and anxious to prove that it was for some good reason, to sub-Saharan Africa to round up Black men and cut off part of their penises is the height of medical colonialism and really horrifying. And the African campaign to circumcise Black men in Africa will go down in history as profoundly damaging and unethical. Follow-up lasted maybe a couple months. Most men were lost to follow-up. They were given a few dollars to have the circumcision. It was disguised as, I don't know, covering their transportation costs or something. And many of the men undoubtedly had serious complications. Then they conducted a survey that found that these men had very high satisfaction rates from their circumcisions. Mm-hmm. These were men who never had a problem. Never had a problem before. And I thought to myself, you don't even want to complain about a bad haircut. You go to the bar, you might change barbers, right? But, these men said, oh, yeah, I'm cool. I like it. I don't know. So those studies are, taken with a grain of salt. Those studies need to be taken with a pound of salt. They're very unreliable. And other claims for circumcision, reducing urinary tract infections in babies. Well, girls get urinary tract infections and higher rates than boys, and they're cured by $1 worth of antibiotics. And there is no therapeutic or preventive purpose to removing a healthy, normal foreskin, which is the most sensitive part of the male penis. The most erogenous part of the male genitalia is the foreskin.
These studies that she references in regards to U.S. military, I will say that was it felt a little bit like, okay, you're doing a study in Africa where, we don't fall too much into stereotypes, but it's just different. The circumstances are different.
I want to...
there are people who have, clean water and access to health care, but there are people who don't.
My assumption is it's basically hygiene and that sort of stuff. Yeah. But that's also why the HIV rates are so different. And also,
yes, exactly.
That's my impression.
Part of me wishes some of her counterpoints weren't so anecdotal. Like, you won't even complain about your haircut. Like, let's say in the worst scenario, like this was an immoral study.
Mm-hmm. Yeah.
But you still get these results that are so drastic.
Yeah.
I want to hear some counterpoints that are like, well, the reason these are unreliable is because this data set is too small or whatever.
Yeah.
It seemed like most of her beefs were just about like, well, yeah, a guy's going to say he likes sex no matter what. But I don't know if that's actually what that study showed. Maybe the study did show people who said that the sex was worse, but it just wasn't the full sample size.
So I followed up with Dr. Grabowski about some of these concerns. Here's what she said. She says those studies have not been discredited. In fact, the 3 randomized controlled trials in Uganda, Kenya, and South Africa are considered among the strongest pieces of evidence in HIV prevention research and demonstrated a substantial reduction in HIV acquisition among heterosexual men. These findings were sufficiently consistent that the trials were stopped early because of clear benefit. So this is the question why, the common discussion point comes up, and we talk about this too, where why do we not see these huge numbers, in the United States or other countries like in Europe? We don't see these sorts of same rates as far as the decline of HIV transmission, even in countries that are mostly uncircumcised. The main reason results differ from studies conducted in North America or Europe is that the epidemics and predominant modes of transmission are very different. In sub-Saharan Africa, the trials were conducted primarily among heterosexual men acquiring HIV through vaginal intercourse. In contrast, HIV epidemics in North America and much of Europe are concentrated among men who have sex with men, MSM, where anal intercourse is the predominant mode of transmission. The biological protection associated with circumcision appears much stronger for vaginal sex than for receptive anal sex. which carry substantially higher transmission risk through different mucosal mechanisms.
Wow.
So we're talking about different things, essentially.
Anal
broadly.
sex versus vaginal sex.
Dr. Grabowski shared a bit more details on this point as well. We'll be sharing the full text of her responses along with research in the newsletter. And while we're here, it seems worth noting that there are advancements like PrEP, which can reduce chances of getting HIV as much as 99%, and DoxyPEP, which can be used to reduce your chances of getting STIs. Links on that below as well. In regards to Georganne's statements about a lack of proper follow-up with participants and reimbursement, here's what Dr. Grabowski had to say. Follow-up across the 3 major trials was approximately 90%, which is considered excellent retention for longitudinal clinical research. Participants were not paid to be circumcised. As is standard in biomedical research, men in both study arms received modest reimbursement for transportation and time spent attending study visits. These reimbursements were reviewed and approved by ethical review boards and were not considered coercive. Importantly, compensation was not contingent on choosing circumcision. With regard to adverse events, the trials carefully monitored complications and published detailed safety data in the world's top medical journals. Serious adverse events were uncommon across all 3 studies. On satisfaction surveys, it is always possible that some degree of social desirability or white coat bias influences self-reported outcomes in clinical studies. However, if there had been widespread regret or major dissatisfaction, one would expect that to emerge more clearly across multiple studies and long-term follow-up evaluations. It largely did not.
Then, because Georganne mentioned this earlier, and it comes up frequently in this debate, I asked about how female genital mutilation, sometimes called female circumcision, compares to male circumcision. Like, is it actually a fair thing to equate?
Yeah.
So this is what Dr. Grabowski had to say to that. First, she said, I really would suggest avoiding the term female circumcision and instead use the term female genital mutilation, FGM, which is the standard terminology used by major international health organizations. The comparison between male circumcision and FGM is medically and anatomically misleading because the procedures are fundamentally different in extent, intent, and consequences. FGM typically involves partial or complete removal of the clitoris and/or other external female genital tissue, often with the explicit purpose of suppressing female sexuality and sexual pleasure. Many forms of FGM are associated with substantial immediate and long-term harms, including severe pain, infection, childbirth complications, sexual dysfunction, and psychological trauma. There are no recognized medical benefits. Safe medical male circumcision, by contrast, involves removal of the foreskin covering the tip of the penis. It does not remove the glans itself, which is the primary structure involved in sexual sensation for men. The foreskin does not contain nerve endings associated with light touch sensitivity, and researchers appropriately evaluated sexual satisfaction and function in the HIV prevention trials to assess whether circumcision negatively affected sexual experience. Overall, those studies did not demonstrate major reductions in sexual satisfaction or function. Honestly, I think equating the 2 procedures really minimizes the severity and harms of FGM. From a medical and public health standpoint, they are distinct procedures with very different implications, risk profiles, and ethical contexts. So her view is it's not really fair to compare them.
Yeah, which makes sense based on, what we just heard. It's a completely different process.
Okay, so we've heard about the rise of circumcision, the backlash to it, and the potential health impacts of the procedure. We're going to take a break, and then when we're back, we're going to hear about why rates are declining. All right, so we've heard a lot already, but now it's time to talk about the decline. So first, we're going to hear from Dr. Grabowski about the Johns Hopkins research measuring the decline. She's going to go back into the history, back to that peak in the 50s and 60s, and then look at why things started going down.
So remember we were talking earlier about 80 to 90% of boys being circumcised in the 50s to 60s. In the 70s and 80s, people started to become really skeptical of the procedure. There wasn't good data at the time. Like, people were doing it for cultural and anecdotal reasons and there wasn't good medical science behind it. So you started to see people question the practice. And in the early 80s, California was among the leaders in stopping Medicaid coverage for circumcision. And so you started to see huge drop off in coverage, particularly on the West Coast and in areas where Medicaid stopped covering the procedure. Then you had at the same time this raging epidemic in Africa, and then people were observing that there was lower levels of HIV in men who were circumcised, but they didn't know if it was because they were circumcised or because they were Muslim, because there was so much confounding by religion there. So that sort of prompted the trials. And then by the mid 2000s, we got all this evidence that it actually was beneficial and it did reduce STIs, lo and behold. So it's been kind of declining in the US for a while, but it's still steadily declining, even though we've have this new medical evidence available to us. A lot of that, I think, has to do with the fact that Medicaid isn't covering the procedure in a lot of settings, but also cultural differences and changes, changing demographics, people migrating into these countries who don't traditionally circumcise. So there's a lot of things going on.
So the study found that in 2012, 54.1% of neonatal males were circumcised. And by 2022, that percentage is down to 49.3%. She also highlighted some interesting demographic differences. So on the West Coast, only 25% of newborns are circumcised, compared to around 70% in the Midwest. Declines are happening broadly among most groups, but the group with the biggest drop-off is wealthy white males.
So I thought the Medicaid thing was interesting because, yeah, if you don't feel strongly either way, but now you're paying out of pocket, then it kind of makes sense that you might skip on something like that.
Yeah, the number of circumcisions might decrease if it's not covered by insurance. And that's kind of like how RFK Jr. is recommending that they stop recommending the Hep B vaccine right after births in the hospital. There's some data that shows that if you don't recommend the Hep B vaccine right after the birth, people just don't get it.
Right. Yeah. And along those lines, I did ask Dr. Grabowski if she thinks because of this and other factors, rates will continue to decline.
Do you think rates are going to continue to decrease at the rate they have been?
Well, given what's going on in public health right now, probably.
Yeah.
Yeah, I mean, I don't want to come off as some huge pro-circumcision.
Mm-hmm.
I think everybody needs to get circumcised kind of thing. I'm sort of in line with the 2012 AAP recommendations, which are this is a procedure that has medical benefits. And if you want to do it, you should have access to it. That's how I feel about it. And I think parents should have that choice and they should decide for them. There are some risks. They're very, if they're done in a safe, sterile environment, they're very, very low. And the AAP's conclusion was that the benefits, the cumulative benefits of 90% reduced urinary tract infections in infants, plus all these other STI benefits, reduced inflammation, easier hygiene, etc. Those benefits sort of outweighed the risk, but they ultimately felt this is someone's penis. It's tied to all these religious and cultural practices. It really should be a decision that's left to parents and adults, right? So that's kind of where I sit. I'm if you want to do it, if it's for you, you should do it. I think Medicaid should cover it. People should have access to it if they want it, because of these medical benefits. And when I see people saying, "Oh, you shouldn't have access," or it's genital mutilation, that's just not true. And I think it reduces the ability of some people to get preventative health care. That's not fair, and that's this is a controversial topic. Obviously, people feel really, really strongly about it, and sometimes in one direction or the other. And I just think people should be armed with all the information, right? They should know that there are medical benefits. They should know that there are risks, and they should make the best decision for their families.
Here's what Laura Carpenter, the Vanderbilt professor, had to say about the declining rates, and why this issue in particular seems to get people so fired up.
Data shows that circumcision rates are decreasing, I think about 5% in the past 10 years or so. Do you think this is the result of the intactivist movement, or is it kind of maybe something that was going to happen, or a mixture? I guess, how do you read the efficacy of this?
I think the declining rates are a result of a number of things. I mean, I think the intactivist movement has been influential in terms of getting people just to sort of question this. Oh, hey, why are we doing this? And at least now you're thinking, oh, wait, okay, this is a decision as opposed to something that happens automatically. And certainly fewer physicians, I think that it's, many may not oppose it, but they're not actively in favor of it either. The changing attitudes about it is important. I think thinking about sort of the idea that people are supposed to be, and parents in particular, are supposed to be these like very intense consumers of healthcare for their kids, and sort of intense decision makers is maybe part of it too. There is probably some association with vaccine resistance.
Yeah, I was going to ask how it compares to, say, that and just general kind of questioning of maybe, you already said medical orthodoxy. Yeah, if you can maybe pull out that thread of like, how does it compare to, say, a movement like that?
If we think about the kind of early vaccine resistance, we see it mostly in sort of natural mothering, natural childbirth circles, and it tends to be a liberal left decision. Healthy living and homeopathic medicine and all of these things will be enough to keep our kids healthy. They don't really need vaccines. Or we're more worried about the small risks associated with vaccines. And, again, we might be more worried about the small risks associated with circumcision than we are with preventing STIs through circumcision, because we're going to teach our kids to use condoms. So this sort of sense about like what the parenting mission is and how health goals can be accomplished, right? So anti-circumcision is kind of associated more with that part of vaccine resistance than it is with sort of the current wave of vaccine resistance. And then there's a complicated relationship to opposition to abortion.
Yeah, that's also on my list, because it's between that or then even like something like animal rights activist. Like I see a lot of parallels, at least in terms of methodology.
Tactics.
So like, can you speak a little bit about, say, the abortion piece then too? Like, how does that compare? That's obviously more of a conservative or right-wing leaning movement, especially in the past, than vaccines, which is now all jumbled, it seems like.
Right. Vaccines is very complicated right now.
Can you talk a little bit about that then?
Yeah, so my sense of the relationship between the intactivist movement and opposition to abortion is the intactivist movement sort of has like these two camps, and they try not to talk about it very much, particularly people who came in through the women's health movement or natural childbirth or bodily autonomy tend to be pro-choice. And you should get to choose about whether or not you keep a pregnancy, and you should get to choose about whether or not you get to keep your foreskin, right? And see that as a consistent message. Yeah. But there's also a save the babies strand in the intactivist movement, and they tend to be a little bit more save the fetus. The fetus is a baby, save the babies. And so they're kind of in this uneasy tension. And again, my experience attending meetings and talking to various people is they just try not to.
Yeah.
Like I've seen it burst out a couple times at meetings.
Yeah.
And it's very tense. Like the opinions are really
it's a passionate
different.
Group of people, I think we can say.
They're a very passionate group of people.
Yeah.
The thing I find most striking, like the reason I ended up studying this as a scholar at all, and the thing I think I find most striking about this is the intensity and durability of the battle. And we see that around circumcision for some of the same reasons we see intense feelings around childhood vaccination, intense feelings around abortion, intense feelings about sex education is another good example. They help people fight about all kinds of things that aren't just that thing itself. I mean, absolutely, people who are pro-circumcision or anti-circumcision have strong feelings about circumcision itself and think it is beneficial or think it is harmful, specifically as it is. But because of the nature of the practice and how people think about it, fighting about it also helps you fight about whether there's too much medical overreach. It helps you fight about what is good evidence in medicine. Are stories of men enough, or do we need big random control trials? It helps people fight about how much different societies can tolerate. It helps people fight about whether natural bodies are better than altered and quote unquote improved bodies. It enables people to fight about the importance of sexual pleasure. And there's almost nothing you can't fight about with it. So I think that is some of where the intensity comes from with a lot of these issues. It's not just the thing itself, but we're fighting about women's roles in society or about how much control parents should have over their kids or all of these other kinds of things.
Right. It's almost, proxy seems dismissive, but it's almost a proxy for these bigger, more kind of almost existential questions.
Our term is symbolic politics.
Okay,
but, but proxy war, proxy war is. Oh, who should make medical decisions? Yeah. I think one of the things I've really been struck with is that people in the intactivist movement and people generally medicine who are in favor of routine circumcision, they all have really the same goal, right? They actually want kids to be healthy and happy, right? They want adults to be healthy and happy. They disagree about the role of circumcision in that. If there's any main message from my research, it really is just the intensity coming from this sort of symbolic resonance of circumcision, how many think, yes, people are concerned about the specific issue, but how much it touches on all these other factors that are things that are controversial in themselves.
Right.
Mm-hmm. And circumcision seems to be particularly dense with those meanings, right? It involves a genital, it involves gender, it involves parenthood, it involves religion, it's bodies, all these things. So I think we see like a particular furor there.
And now to take it back to Georganne, as far as the work her group, Intact America, is doing, where does she see that group's role in the current decline?
So as far as kind of your group and the actual work you're doing, what would you say what are your main goals? Like, are you trying to pass legislation or get some policies input as far as public health? What's your kind of mission?
I believe that legislation follows popular opinion. Think of how long it took to get same-sex marriage, legislation for same-sex marriage, and now the popular outcry against some of the things that we were able to achieve, some kinds of human rights advances we were able to achieve, and all kinds of reproductive rights are under assault. Mm-hmm. So I believe that it's going to be a long time before we're going to get any laws against male circumcision. I believe that the advocacy that we do influences people. We certainly want to save babies. We want people to not think that they need to circumcise their sons in order to be good Americans or good parents. And people need to be educated about this. And once you start talking about it and you say, this is a normal body and, sexuality is, something we should be discussing, and doctors need to understand what that body part is. And they need to understand. You shouldn't have to tell a doctor or a nurse that cutting off a normal part of somebody's genitals is excruciatingly painful and damaging. But as a culture, we're so ignorant and in such denial that this needs to be done. We need to talk about this. We need to talk about it all the time. So that's what Intact America does. We talk about it all the time. I'll talk to anybody who wants to talk about it. And there is undoubtedly a trend, to a lowering trend of circumcision, although we're not confident about the numbers. But at the same time, the medical establishment continues to promote infant circumcision.
So I asked if the rise of distrust of public health in recent years has enlivened her cause. Mm-hmm. I was like, social mores seem to be changing. So this her response on, the questioning of the medical establishment that we're seeing.
I do believe that all this questioning is good. I think some of it is very suppositional, and there's not a lot of evidence, or there's evidence contrary. There is no evidence that circumcising a baby is a beneficial health procedure. None anywhere. So I don't see it as a controversy. Circumcision is not controversial from a medical standpoint. It's only controversial from a sociocultural standpoint because it's taken hold. But, people are definitely questioning. And that's why you see the medical industry continuing to push it, because there are vested interests. And the vested interests are not just financial. they're also sociocultural and psychological. So if you've circumcised 5 sons, if you've conducted thousands of circumcisions in your career, right, you have skin in the game, and not in a positive way. So it's hard to change cultural norms, and that's why it's so important for people. This is so important what you're doing, to talking about it, and I'm sure we'll have people listening. It's so important to think about this stuff and think, what exactly am I defending if I defend circumcision? I'm defending the mutilation of a helpless baby's natural, normal body that evolved over millions of years. This is a normal, sensual body part that we are chopping off. And if we come back to feeling compassion for this newborn child or this child, that goes a long way to setting your instincts where they should be. And if we go to what we all really subscribe to, an ethical code, which is that you don't assault people, you don't assault people's bodies. If you don't just willy-nilly remove body parts from somebody, then that tells you, what we should not be doing, which is assaulting a newborn baby and removing part of his or her genitalia.
I think she probably would have won a jury over.
If
this were a trial. I mean, our thing here, it's like that study that Kate did where it showed a drastic decrease in transmission of STIs. It just doesn't, that's nice, but it just doesn't feel like enough of a reason to do it to the babies, right? Like if you become older, sexually active, and
then you make that allow the child to make the decision later on.
Well, what she was saying about this is how we naturally enter the world. This is what naturally occurring. Yeah. It's everywhere in nature.
Every primate.
It's compelling.
Yeah, and it's totally fair, and it's so much of this is you're a father or whatever, so you just do the same for your son.
Yeah.
And you're the same as your dad before you, or what have you. So that makes sense. It is just like she says, a sociocultural norm. That's why you go to France, it's not going to be the same, or wherever, There's something to it for sure. I think I line up basically with Dr. Kate, where it's kind of I think it's good to know the possible impacts. And if these rates continue to decline and it ends up being basically only Muslims and Jews in America doing it, I don't think that's going to mean there's going to be, surging rates of STIs or other negative outcomes.
Yeah.
So I think it's to me, it's just you should do what you want. And I don't think it's whatever barriers in my head. Parents have to make decisions for their kids all the time.
Yeah.
And it's to me, it's not so dissimilar from when a parent gets their baby's ears pierced and they do it when they're really young instead of older, because it's they'll just get over it then.
Yeah.
That's my view.
Yeah, it's a really interesting issue. It's if I have a boy, I probably would not get him circumcised. But I personally also don't feel like I'm missing out on literally anything, or it just doesn't feel like I wouldn't do it because it's there's not enough of a reason to do it.
Yeah.
The baby, I wouldn't do it not because the baby's in pain. Or whatever.
It's more
they're actually
more general.
Be crying for 3 months straight after being born, no matter what happens. but yeah, I don't know. It just doesn't feel like if you don't do this, then there doesn't seem to be an immediate reason to do it.
You're thinking basically let them make the decision if they want to do it later on.
Yeah,
or that basically they're not going to get it done.
They're probably not going to get it done.
Most likely, I would assume not. Yeah.
But that's kind of why I wouldn't do it.
Yeah.
If you get to age 18 or whatever and it's your choice and you're not going to do it, probably, then I'm not going to do it early on.
No,
That makes sense.
Yeah, it's
Makes a lot of
extremely
sense.
logical.
Like if I didn't
yeah.
get circumcised
You
and
wouldn't
then
do
I
it
was at
now.
18, I probably wouldn't get circumcised.
Oh yeah, I would.
Now that doesn't
yeah.
mean if you're circumcised that you're like
You're
living
living a
a
different
much
life.
worse life.
Yeah,
but
yeah.
like
Well, you're living different,
you
but
know.
yeah, it's not worse necessarily.
yeah.
it's
Yeah.
doesn't feel like a thing that needs to be done.
This is interesting. I don't think I'm gonna get my kids circumcised because
Yeah.
you're following dad's
It just doesn't.
footsteps.
Yeah.
It's pretty fair.
Yeah, it's as someone who's had my own sort of transformation on this issue, at least thought wise, where at one point I was like, annoyed that I was not circumcised,
Oh, right.
and it is interesting to hear both sides. I think people should. I'm not someone who at this point I don't think there's enough that I've heard to say that people should not have the option.
Yeah,
Right.
I think that's something that was interesting to me because like here we are, we're talking about it. These people are very strongly. I mean, I guess it's like if you think something really horrible is happening, you want to stop it,
Well, let's
even
put
if
it
it's
this way.
even if it's you don't necessarily need it to be illegal.
No.
So it makes sense. It's like being vegan or something, where like
Yes.
if you really believe this is so horrible, this is going to be your cause. Because it's like she's not pushing legislation now or to ban it.
Yeah.
Because I think the downstream effect of that would then it's like, well, it's a religious thing, whatever.
Yep.
It would be challenging to get it banned on those means.
Yeah.
Or like once you hit that wall. But yeah, because it's interesting because it's like, well, everyone has the option. I guess it depends how heavily you think the doctors are pushing it or not.
Yeah.
Well,
is where
that's
it
what
really
I was
comes
gonna
down
say,
to,
right? Like I can
the pressure.
I understand making it. If you want to do it, you can have it. But I think part of the intactivist. I think part of what it sounds like your messaging is like basically we need to do more education.
Yeah.
It sounds like you don't trust the medical establishment right now. It feels like they think there's a lot of misinformation. They're telling people things they shouldn't do, which are harming their kids. They have these preconceived notions. They're relying on these studies, which they feel are unreliable. So there's like this education proponent of like, hey, we need to let these people know that what they're saying is incorrect because they have a lot of influence. When you're going through the process of having a child, you're going to, most people, I know now we're in this moment, but most people are going to defer to whatever the doctor says, right? And both me and Manny's case, that was kind of like, that's why we are where we are today.
Yeah.
My mom's doctor was like, whatever, you don't really have to do it now. He can do it down the line if he really wants to do it. And Manny's doctor was like, you should do it.
Yeah,
right.
yeah,
And
that's
like,
what we do,
that's our parents weren't Googling things back then, right? They weren't reading up on it. They were just like, this is what the doctor told me. Obviously, people can do more of their own research now.
Yeah.
But I think people should just be able to make their own decisions, but also have access to all the information to make that decision.
Because I feel like this kind of movement would basically be happy if it was, instead of being something that was asked, was basically something you have to ask
You
for.
opt into
and I
yourself.
think that small shift would probably
It would destroy the rates of
it
circumcision.
would probably have pretty big impacts,
Totally
especially
crash.
if you get maybe 1 or 2 generations down where I mean even now it's under 50%.
Yeah, I think the big thing, I think that's going to be big.
It's just
I think
time,
it's going to be cultural stuff too. I think maybe that will become even more important than what the doctors say, right? Because if all of your peers are not circumcised, it doesn't really matter what the doctor says. You're going to say, well, most of these people are not circumcised.
Yeah, so if the rate goes
down,
down to say, let's see, it went down 5% in 10 years. If it goes down another 10% in the next 20 years or whatever, then it's pretty low.
Yeah.
Then
you become the odd one out too.
Yeah, so it's like, it really is a decision versus like kind of the default.
Yeah, exactly. Yep.
So time will tell. We'll, on episode 3000, we'll check back in.
No such thing.
No Such Thing is a production of Kaleidoscope Content. Our executive producers are Kate Osborne and Mangesh Hattikudur. The show is created by Manny Fidel, Noah Friedman, and Devin Joseph. Theme and credit song by Manny. Mixing by Steve Bone. Our guests this week were Kate Grabowski, Laura Carpenter, and Georganne Chapin. Thank you sincerely to all of you for your help with this episode. Visit nosuchthing.show to subscribe to our newsletter. I'll be adding tons of links to research so you can dive in yourself to read more. There was tons of stuff that we weren't able to include in the episode, so if you have questions, please check it out. If you have feedback for us or a question you'd like us to answer, our email is mannynoahdevin@gmail.com, or leave us a voicemail by calling the number in our show notes. We'll be back next week with a new episode. Bye.
No such thing.